Well, good morning. Good morning to this morning's live stream. Follicle Fix at 6, our daily morning program on things related to hair loss treatment for men and women and hair transplant. And first, I'll deal with an alarming situation that happened in Kanpur, where a patient died very recently and which is in the news. We will discuss what happened, what are the reasons why such fatalities happen, and what are the measures that the clinic should undertake to prevent such fatalities from happening, and also the choices that the patients should make before the critical surgery of hair transplant surgery. So we will deal with these points one by one, and at the end of the session I will answer questions about whatever questions you may have about hair loss treatment or this video. So the recent tragic death of Vineet Kumar Dubey, a 37-year-old assistant engineer in Kanpur, following a hair transplant procedure, underscores the critical importance of stringent medical standards and ethical practices in cosmetic surgery. This incident, which occurred at a private clinic in Kanpur, has raised serious concerns nationwide about the qualification of the practitioners doing hair transplant surgery and the protocols in place before, during, and after the procedure. Mr. Dubey, as we all know now, underwent the hair transplant on 13th of March this year. The following day, his wife received a call informing her of facial swelling, intense facial swelling, immediately after the procedure, and his subsequent hospitalization in a local hospital. Despite medical intervention, he succumbed to his complications after 2 days, that's on 15th of March. And reports that have come in suggest that the procedure was conducted by a practitioner whose qualifications are now under scrutiny, with allegations pointing towards inadequate medical training for performing such surgeries. So this unfortunate event highlights the potential risks associated with cosmetic procedures when performed without adherence to established norms, established procedures, established medical guidelines. It also emphasizes the necessity for patients to verify the credentials of medical professionals and the standards of the facility where they are contemplating to get the hair transplant done. And this case, this Kanpur incident, is a somber reminder both to the practitioners doing hair transplant and to the patients at the same time. It is a somber reminder of the paramount importance of patient safety and ethical responsibility in the field of cosmetic surgery. Hair transplant has become increasingly popular worldwide as a cosmetic surgery procedure. And though we expect that over the years people would know more about hair transplant, but the problem is that a rash of unethical clinics the world over have opened up, which throw caution to the wind, do not follow laid down protocols, and lack proper training and proper facilities. While generally considered safe when performed under proper standards, hair transplant is generally without risk. Deaths after hair transplant, like this one, have on investigation several times revealed one constant denominator, and that is the doctor was not doing the procedure. The clinic was ill-equipped for a surgical procedure like hair transplant. And the complication when it occurred took everybody by surprise. Firstly, they could not recognize the complication when it happened, and secondly, they delayed. They did not understand the gravity of the complication and delayed emergent patient care. It is only when things go out of hand, the patient goes into marked sepsis, low blood pressure, goes into shock, that the reality sinks in and the clinic shifts the patient to another hospital. So this has been happening over several years with clockwork precision. And let's understand the factors even more, how these things happen and how we need to take care. So today we will try and understand the multifaceted reasons behind adverse outcomes, including mortality. And I will try to emphasize the importance of responsible practice, of qualification, technique, and sterilization in the operation room. Now first let's talk about the safety profile. When a hair transplant is performed by trained, qualified people who have been to the rigors of surgical practice, who know about operation theatre routine, who follow strict protocols by training, hair transplants are safe with minimal risks. However, complications can arise due to improper selection of cases in spite of existing health issues. They can arise because of technical errors, because of inadequate sterility, or improper patient management during the procedure and after. So, what are the various reasons due to which a fatality, a death, a mortality can happen in your clinic? Though rare, as already told to you, mortality following hair transplant can result from a host of factors which are all preventable. And number one is infection and sepsis. If you have not evaluated the scalp of the patient for pre-existing infection, if you have not ruled out diabetes, if you have not ruled out certain skin conditions which have low vascular supply, low blood supply, if you have not ruled out pre-existing infection in the patient, a lot of complications are in store. A detailed consultation should be done, proper scalp analysis, proper lab work has to be done so that we can prevent infection and sepsis from happening. Another trend nowadays is to give high density slits. When you give high density slits and you don't give them properly, it's like making mincemeat of the scalp. And if, because of lack of blood supply, the scalp was to die off, it will cause unremitting infection which might travel into your eyes, like it happened in the Pakistani patient in Pakistan who underwent a hair transplant in Lahore, who died. Not died, who lost, he was a celebrity and he lost one eye. And infection can happen from contaminated instruments, from improper sterilization, poor aseptic technique, and bad surgical technique, like I told you about making mincemeat out of the scalp by doing high density slits, being carried away by the call of present times of giving high density results. But when complications happen, if they are not promptly recognized and treated appropriately, local infections, which may be very small to start with, can spread out into a jungle fire and progress into systemic sepsis, which can be fatal. In many of these deaths that we have encountered in clinics reported on the internet and on social media, the underlying factor has been hyperglycemia in a large number of cases. Patients not having been worked up properly before being taken up for the procedure. Only after the complication starts to happen that the clinic goes into top gear and finds that there were certain systemic problems that the patient had which were not detected before the procedure because no testing was done. And then there are other contributing factors like overcrowded clinics performing large numbers of procedures daily. And this results, of course, in inadequate sterilization protocols, poor patient hygiene, not washing the patient's head aseptically. And then there are anesthesia-related complications, which you cannot predict, but with good technique, you can avoid anesthesia going into the vessels. You can also make your clinic prepared, ready to tackle any complication related to anesthesia that might happen. See, mind you, anesthesia complication has to be managed in the first 3 minutes. A lot of anesthesia, a lot of local anesthesia is used in hair transplant surgery. So incorrect dosage, incorrect technique of administration, that is administering anesthesia right into the vessel, and it can go to the heart, can cause severe adverse reactions, including sudden cardiovascular collapse. And then let's talk about sedation and general anesthesia. Though general anesthesia is not what we do hair transplants with, mostly it is done under local anesthesia, and at times we need to have sedation because the patient's vital parameters, patient's heart rate is very high, patient is anxious, and it's quite common to give some form of sedation, not that to put patient to sleep, but to calm the patient down. Because a patient who's sleeping is not a good thing, because the patient has to cooperate during the procedure, he has to keep moving, and we have to discuss various hairlines and so many things we have to discuss. We don't want the patient to be sleeping. So if sedation is used, it carries the risk of respiratory depression, of allergic reactions, can have cardiac events if administered improperly. And then thirdly, hemorrhage and shock, though very rare, if excessive bleeding can happen if during or after surgery some vessel starts to bleed, and it can also lead to hypovolemic shock. We might laugh it off by saying that, oh, hair transplant does not cause so much of bleeding, but rarely, if you struck a vessel which is moderate in caliber, and the patient goes back to his hotel room, and especially if the patient has been taking aspirin or is not told you about blood thinners that he's taking, he might bleed during the night. Vascular injury can happen by improper technique, though not very common in FUE. This can damage vessels, this can damage blood vessels and lead to significant loss of blood. But see, any complication that happens, you have to know how to tackle the complication. That is the training of a doctor. So that is why a hair transplant should only be done in a qualified center by a qualified doctor, because he knows how to tackle the complication if it occurs. It's not a mechanical process of moving grafts from one place to the other, and if a complication happens, you shift the patient immediately to the nearest ICU. You can do that, but in this process, you will not be able to understand what the patient is experiencing, what complication is going on, and you have missed that initial opportunity, that golden hour when you could have responded medically and saved the patient. And then allergic reactions can happen due to anesthetic agents, due to antibiotics, other medications, and this can cause anaphylaxis, which can also be life-threatening. But if you know how to tackle it, there's no problem. And then rarely thromboembolic events can happen, like prolonged immobilization because of hair transplant can take up to 10 hours, can cause dehydration, it can cause pre-existing hypercoagulable states, can predispose the patient to DVT, that is deep vein thrombosis, and this may lead to pulmonary embolism without your knowing. So these are things that we do not test the patient for DVT before a procedure, but keeping the patient in a qualified clinic, you will get the early signs. You can detect the early signs of pulmonary embolism if you are adequately trained to manage such emergencies, not otherwise. And then there are underlying conditions that the patient may have. He might have diabetes, hypertension, cardiac disease, which put him at a greater risk. So as an overview, let's just wind up by saying the key factors that contribute to fatal episodes are large case load, inadequate sterilization, unqualified practitioners, lack of emergency preparedness on the part of the clinic and the doctor, and a host of patient factors which go undetected. So the problem is that such incidents, when they happen, put hair transplant procedure in bad light. And this therefore underscores the importance of strict adherence to clinical guidelines, choosing qualified practitioners and maintaining standards of infection control. At my clinic, I ensure my philosophy of one doctor, one patient, one clinic. This is a simple, no jargon protocol that emphasizes and underlines the importance of personal responsibility of the doctor, continuity of care, and avoiding commercialization of practice. And I think no doctor has the business of doing more than one procedure in a day, because then he's not doing it himself. He's delegating it to unqualified staff, and that's a big red flag sign. But as a patient, what should you do? How should you be careful? Check the doctor's qualification and experience, whether he has proper training, his credentials. Avoid unqualified practitioners. See the clinic and its infrastructure, sterility, equipment, staff training. Whether the clinic follows proper standardized procedures, and whether there are facilities to monitor the patient after hair transplant. Does the clinic do several cases in a day? Infection control, scheduling and staffing, whether the same staff is doing the procedure, the plantation, day after day. So these are the things that one must understand. And the best part is not to rush into, the best advice from me, I've done a video on this also, is not to rush into hair transplant. See, this is a once in a lifetime procedure. It's a surgical procedure. It carries with it humongous amount of risk if not done properly. One should spend time in researching the clinic, not by going onto the forums, and all forums are paid forums. And clinics which are shady clinics have more to gain by spreading so much of false information about the clinic all over the internet. So the best advice would be to you, number two advice. One is, spend a full day, due to some excuse or the other, in the clinic. Sit in their lobby, watch what is happening, make inquiries, go around, ask the staff, ask the other patients what it's all about. And only then your gut instinct will tell you whether to go in for a procedure here or not. The second one, which people still, after my having told them n number of times, do not pay all the amount before the procedure starts. In my clinic, we tell the patient only to pay 20%, which includes the signing up fee. Just pay 20% and then pay after the procedure is over in the evening. So this ensures that a qualified person will do your procedure. You will get what you have paid for, and due care will be exercised in your procedure. So these are the things that you should, as a patient, it's your responsibility also to save yourself from such anguish and to keep yourself safe. So this is about the talk about, I thought I will cover this thing because it appealed to me, and many of my patients were asking me about how the death in Kanpur happened and how to prevent choosing such clinics. And I hope I've made myself clear about what all you should search for and what are the ways to choose the right clinic and what are the red flag signs. So if there's any question now on this talk or anything about hair loss treatment for men and women, you may please ask and I'll be happy to answer. If there isn't, then I'll go into my bank of questions that I've gathered over the last one day and I'll answer the questions one by one. Okay, so we go on to the questions. I'll open my channel. Community. So the question is from Mr. Allen. Can use dutasteride under age of 18 because I'm suffering from male pattern baldness. I know my DHT level is high. DHT level being high is not the factor that is responsible for male pattern baldness. It is your sensitivity of the follicles to DHT. You might have very high levels of DHT, but if you do not carry the male pattern baldness gene, you will still sport a head full of hair. At the age of 18, when your development, especially your sexual development, is not yet fully fully achieved to its full capacity. You have not achieved maturity, which you do at around 21, 22. You should not be on DHT blockers because DHT blockers are not good. It's not good to block your androgens at such a tender age. And the next is, dude should have been a poet. Yes, of course, yeah. I have been writing for local newspapers, light-hearted columns. I love that, yes. That is also my hobby. But my prime profession is hair transplant, my bread and butter. So I cannot go on to poetry at this time of life because I'm fully committed to hair transplant surgery. And I have a lot of patients all over the world to take care of. So Mr. Nutritionist Sarvesh. So I did a video on whey protein and hair loss, and he has commented on that video. He says excess of anything is bad. Heavy metals are found in vegetables, fruits and fish. Growth hormones are found in broiler chickens. Pesticides, fungicides and herbicides are found in vegetables. Microplastics are found in bottled water, tea bags and many such other products that we may not think. We have polluted the environment to a very large extent. Yes, you're right. In a great way, one has to lead a healthy lifestyle and avoid as much as possible these deleterious micronutrients and nanoparticles from reaching our system. Yes, that is true. As much as you expertise in hairs, you have the expertise in poetry, literature, and choosing beautiful words for your thoughts. I couldn't help but appreciate that. Thank you, Mr. Shabazz Khan. You're very welcome. Thank you for being here and encouraging us by being with us on the channel. And I hope you've subscribed. Manika Gupta wants to know, how do you confirm androgenic alopecia? Well, androgenic alopecia has a typical pattern of thinning and hair loss. The hair are healthy, but they are going away, disappearing. And a hallmark is that the back of the head is spared. It is a symmetrical pattern. And then, moreover, you have family history of baldness. This is a clinical diagnosis. We cannot diagnose androgenic alopecia based on either genetic testing or on the basis of lab work. So it's purely a clinical diagnosis. Ms. Manika Gupta says that my son is 22 years old and he has been experiencing hair fall since 1 year. He has now left taking whey protein, but hair fall is still there. What all tests should be done to see if it is indeed androgenic alopecia? So I've already, Manika Gupta, answered your question that no amount of tests can tell you whether it's androgenic alopecia or not. It is only a clinical diagnosis which is bang on 100% correct. You send me the pictures and I'll tell you whether it's androgenic alopecia or not, and send me the history of baldness in the family, especially on the maternal side. Doctor, what about hair cloning? Yeah, yesterday I did this video and I didn't talk about hair cloning. Where hair cloning, I don't think it is going to come very soon because it has a lot of administrative regulatory hurdles. It is already there. If permission is given, it will be there by next month. But the thing is that if you start cloning hair, tomorrow you'll clone a man. So that is what regulations all over the world are not allowing. So it will be a huge leap if it happens in hair transplant, but I don't see it happening. I've been hearing about it since last 15 years, 20 years, since I've been in practice. But now talk about hair cloning has died down. It only resides in the realm of theoretical papers and on various forums, patients endlessly waiting for hair cloning to happen and doing disservice to their existing hair loss pattern, which develops even further. And while waiting for hair cloning to happen, not taking treatment that is available, they soon pass off from forums and go on with their lives, and you never hear about them again. Hello Dr. Bhatti, I've been using finasteride for 2 years and the results are awesome, but for a few months it's stopped working and I'm still taking the 1 milligram per day. What should I do? Please, doctor, answer my question. I am stressed. This is a common thing if you take medication without supervision or your doctor is not guiding you properly. Any medicine which affects your hormones is going to become, the body is going to become tolerant to it if you do not follow certain protocols. And if you search my video, which if you search on Google, on YouTube, and just type in Dr. Bhatti 5 strategies for finasteride, and YouTube will get you there. This video will tell you about the 5 strategies that you should use, in which you can use less dosage with maximal output or maximum results, and at the same time with least amount of side effects. So please watch this video, Dr. Bhatti 5 strategies of finasteride, and you will come to know. If there's still any question, let me know and I'll answer it. Next question is, hello sir, my age is 27. After a lot of research on finasteride, I fear mental related side effects of finasteride, but due to my rigorous hair fall since 19 years of age, after watching a video I decided to take finasteride 3 times a week. So what to do, please? So you're talking about not mental related hair side effects, you're talking about brain fog. Yes, brain fog can happen if patients are not chosen properly, but you have to see the real reason for brain fog. Please type on YouTube, search Dr. Bhatti brain fog and finasteride. Dr. Bhatti brain fog and finasteride, and you will reach that YouTube video that I did, and I have discussed brain fog in great detail. But still, if you continue to have brain fog, please go off medication, because health is more important than your hair. Another question by Mr. Vasu Prajapati. Hello doctor, how to avoid finasteride tolerance? See, Mr. Prajapati, I've already covered this in the last few sentences. That go to this video titled Dr. Bhatti 5 strategies for finasteride, and you will reach the video, which you must watch in full. So these were the questions asked yesterday, which were worthy of bringing out to you this morning. So good morning, Mr. Gaurav Sharma. Nice to see you there again. We have Mr. Aditya Chauhan, though he has not subscribed yet to the channel. He wants to ask a question. Hello doctor, I have been using finasteride for 2 years and the results are awesome, but for a few months it stopped working. So Mr. Aditya Chauhan, I just answered your question which you asked yesterday on the internet, on the YouTube channel, and I hope it answers your question. Mr. Gaurav Sharma wants to know, have I made a video on reviewing topical finasteride? Yes, I have. If you go onto my video, you only have to search on YouTube, search Dr. Bhatti 100 points about finasteride, and I've covered it in great detail there. But still, if you have any doubts, let me know. Topical finasteride is just a commercial preparation. It does not reach significant levels to prevent the progression of baldness. For that, we have to take topical finasteride and wait till such time topical finasteride becomes better and is able to give us the results from topical finasteride that we wish to achieve. Mr. Nikesh, hi doctor, sometimes I see my leg small hairs in my on the floor. I hope my legs hair too, I hope not, they are not falling. Is it due to my androgenic alopecia? No, leg hair don't fall because of androgenic alopecia. In fact, high amounts of DHT are good for body hair. So it could be because of many other reasons. It could be because of friction, because of your trousers that you wear. It could be because of skin condition, and please show it to some skin specialists locally. They'll be able to tell you if there's a skin condition which is causing hair loss in your legs. Gaurav Sharma says that does hair fall happen till 55 years of age? Does hair fall stabilize after 45 or 55? What does your experience and observation say? My experience says that after 35, between 35 and 45, patients have manageable levels of hair loss progression. And after 45, baldness progression is so slow that I do not advise patients to go and take DHT blockers because it's so slow and it is hardly seen. And even if it happens, you can get a hair transplant done, small procedure, rather than take medication for a long period of time. So I advise that at between 35 and 45, you should energetically take it upon yourself that you have to go off finasteride. You can't take any medication lifelong. Mr. Aditya Chauhan, I watched your strategy video. The question is tolerance is developed. Should I stop taking finasteride for 1 month? After then, start it again? Yes, please. Go off finasteride for about 1 month. You may lose some ground, but then it's all for your own good. You will gain it back. Stop it for 1 month. Get your total testosterone level done and total estrogen level done, because why not have reports at hand? And if you want, you can also get your semen analysis done for sperm count. And then start. God's Judgment Coming to America, that's the name of the YouTube channel. He wants to know, if you had 5 straight years of hair transplant procedure and all being around 1200 grafts each without over harvesting, can you still get a good result with a good hair transplant doctor? 1200 grafts over 5 straight years, that means 6000 grafts. Yes, 6000 grafts can easily be harvested from the scalp, and if you've done 1200 grafts properly by maintaining the integrity of the scalp donor, yes, 6000 grafts is enough to give a good result for grade 5 and some grade 6 patients. And then also we have body hair. Many clinics don't do body hair, but if you have body hair, you can even increase this graft number to up to 8,000, 10,000, even more, depends upon how many hair you have. Chad wants to know, hello doctor, I asked you yesterday about taking oral finasteride. I deal with anxiety and depression. I really want to try it though. I started medicine for the anxiety and depression. Should it be okay? Yeah, you just discuss it with your psychologist, your treating physician. And I would advise that you get your tests done first and then start oral finasteride as a test dosage for 4 to 6 weeks, and then come back on this channel and then we can discuss how you are, how you have been tolerating, how your mind has been tolerating this drug, how your body has been tolerating this drug. So thank you so much. Thank you, Mr. God's Judgment Coming to America. Thank you for your indulgence being on this channel. For those who haven't subscribed, please do. Your being on this channel keeps it going. Have a nice day.